You sleep for 8 hours, but still wake up exhausted. Your partner says you snore, suddenly go quiet, then gasp for air. And during the day, staying focused feels harder than it should. These can be signs that your breathing keeps stopping and starting while you sleep. This is called sleep apnea. Left untreated, it can hurt your sleep quality, concentration, reaction time, and long-term health. In the next few minutes, you'll learn what causes it, the warning signs you can actually notice, how doctors test for it, and how the main treatments work. One important thing, not everyone with sleep apnea looks or sounds like the typical loud snorer. Sleep apnea means your breathing repeatedly stops and starts during sleep. The most common type is obstructive sleep apnea, or OSA. When you fall asleep, the muscles around your tongue and throat relax. In someone with OSA, the upper airway can become narrow or completely blocked. Airflow drops or stops, even though your body is still trying to breathe. Then breathing starts again. And this cycle can happen over and over while you stay mostly unaware of it. That's why some of the clearest warning signs are often first noticed by someone else. An airway blockage isn't the only way sleep apnea happens. In obstructive sleep apnea, your brain is still sending the signal to breathe. The airway is just blocked. In central sleep apnea, the problem is different. The brain temporarily stops sending the signals needed for normal breathing. Certain conditions that affect the brain, heart, nerves, or breathing control can raise the risk of central sleep apnea. Long-term opioid use can also interfere with how the brain controls breathing during sleep. Knowing which type you have matters, because sleep apnea is not one single problem with one single solution. With obstructive sleep apnea, anything that makes the upper airway narrower or more likely to collapse can increase the risk. Extra weight is one important factor, because more tissue around the neck can help block the airway. But body weight is not the whole story. Large tonsils, a large tongue, the shape of your neck or face, age, genetics, and some hormonal or medical conditions can also raise the risk. Alcohol relaxes the muscles in the mouth and throat. Smoking can cause inflammation in the upper airway. So you shouldn't dismiss the possibility of sleep apnea just because you don't match one common body type. 3 classic nighttime signs are breathing that repeatedly stops and starts, frequent loud snoring, gasping or choking for air. Imagine someone next to you hears snoring, silence, then a sudden snort or gasp. That pattern tells you more than just you snore a lot. But snoring alone does not mean you have sleep apnea. A proper evaluation usually needs a sleep study. Here's the tricky part. The person who has these events often remembers none of them in the morning. The clues show up later. One of the biggest daytime clues is feeling excessively sleepy or tired, even after enough time in bed. Other possible symptoms include dry mouth in the morning, headaches, trouble focusing, fatigue, trouble sleeping, lower sex drive, waking up often at night to urinate. Symptoms can look different from person to person. Women more often report fatigue, headaches, and insomnia, which is one reason sleep apnea is sometimes missed. No single symptom proves you have it. It's the overall pattern that raises concern. Sleep apnea is more than just annoying snoring. The repeated drops in oxygen and constant sleep disruption can affect concentration, memory, decision-making, and how alert you feel during the day. Untreated sleep apnea is also linked to higher risks for heart and blood vessel problems. That doesn't mean every tired person has sleep apnea, and it doesn't mean everyone with sleep apnea will develop serious problems. It simply means persistent symptoms deserve a proper check instead of guessing. A doctor will usually start by asking about your symptoms, risk factors, medications, family history, and what anyone has noticed while you sleep. Then comes the key test, a sleep study. The study records what happens to your breathing while you sleep. It helps show whether you have apnea, which type it is, and how severe it is. Some people can do a home sleep apnea test. More detailed testing can be done in a sleep clinic or hospital. A home test is designed specifically for sleep apnea and does not check for every possible sleep problem. One number you may hear is the apnea-hypopnea index, or AHI. This is the number of breathing pauses or shallow breaths measured per hour of sleep. That number helps guide the next steps. Treatment depends on the type of apnea, how severe it is, and your overall health and anatomy. For obstructive sleep apnea, lifestyle changes are often part of the plan. These can include reaching a healthier weight, being more active, limiting alcohol, quitting smoking, and sometimes changing sleep position. One of the most common treatments is positive airway pressure, or PAP. A CPAP machine sends a steady stream of air through a mask to keep the airway open while you sleep. Other machines can adjust the pressure in different ways. If CPAP is hard to tolerate, some people use a custom oral appliance that holds the jaw or tongue in a better position. For certain patients, surgery or other procedures may help. Options can include tonsil removal, jaw advancement, removing tissue that blocks the airway, or an implanted device that stimulates the nerve controlling the tongue. There is also a newer option for a specific group. In the United States, the FDA has approved Tirzepatide, Zepbound, for moderate to severe obstructive sleep apnea in adults who have obesity, used together with diet and exercise. It is not a treatment for everyone with sleep apnea. The growing number of options makes getting the right diagnosis especially important because the best solution depends on why the breathing problem is happening. Remember the pattern. If someone notices that you repeatedly stop breathing, gasp, or snore heavily, or if you consistently wake up unrefreshed and feel unexplained daytime sleepiness, talk to a healthcare professional. They may recommend a sleep study. Don't try to diagnose sleep apnea from snoring alone. And don't assume that 8 hours in bed automatically means 8 hours of good sleep. With sleep apnea, the real question isn't only how long you sleep, it's what happens to your breathing while you're asleep.